572-0215. Rev-Up St. Lucia, the alpha of radio.
It's now time for Doctor in the House with Dr. Leonard Suraj, brought to you with the compliments of La Place Salazar, Ultramat, Susie's Variety, and Tapio Hospital.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapio Hospital, where the patient's safety comes first.
Are the guru of groceries. You have a heightened awareness for lower prices. You journey to find freshness and variety and quality brands, and you have an acquired taste for specialty items. You want to set a good example for your followers. And that's why your higher calling is Susie's Variety Store. 2 stores that beat the giants on pricing, variety, and quality. Susie's Variety, small store, big love. Located in Cantonment, Vieux Fort, and Bois d'Orange, Grozier. Telephone 458-4161.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
La Place Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar, Castries, Groselet, Vieux Fort, and Soufrière.
It's delicious.
Dr. Suraj, welcome.
Thank you, Andre. Thank you once again for allowing me to use that program.
You're welcome, and thanks for your service.
Good, thank you. Last week we were talking about sudden death, and of course we spoke about the possible causes and the prevention, etc. Today I will not be as gruesome as talking about sudden death, but I'll be talking about ENT emergencies as it pertains to ear, nose and throat issues. And it follows the same set of rules, like the airway can be matters relating to the airway, to bleeding, to brain injury, and circulation at large. We'll also be talking about problems as it relates to both children and adult, because children do have quite a large area where things can happen, and they can have many different type of problems. Either out of innocence, they develop problems. For example, in a child, the easiest thing, they're very curious and they push things in the nose, they swallow things like coins, etc. I've had many occasions when the child, you would not know they have something wrong, like a foreign body. It's only when you realize one nostril is discharging and the other one isn't, and persistently. So parents even say, oh, he has a cold in one nostril. That doesn't make much sense, but they believe it. So,
Sorry.
yeah.
You know, I think I found myself saying that already. Yeah.
Yeah, I'm calling one. The one nostril.
One nostril. Now that you said it.
If it is one nostril, something else maybe. Usually children like 2 years, 3 years. When they get a little older, they wouldn't do it that way. If something is itching in the air, they'll push something in.
So Dr. Suraj, now that you mention that, why does that happen? Sometimes you have one nostril that's blocked and the other nostril is fine.
There is. I will come off my emergency and talk about that issue.
Yes.
There is, in physiology, which is the working of the body. That's one of the disciplines you have to learn in medicine, physiology, how the body works, anatomy, what are the composition of the body, bones, muscle, nerve, vessels, etc. In physiology, you learn that the nose has what you call a nasal cycle, a cycle that operates whereby one nostril is open, after a while both of them remain the same, and later on the open one become closed, the closed one open.
Right.
The cycle is about every 4 hours or so.
Oh, really? So this is a natural process?
A natural process.
Wow.
And but at the same time, as it will turn out, if you can breathe with one nostril, breathing from one nostril alone can actually make you comfortable and you don't even know which nostril you're breathing from.
That is true.
So it is not a matter of both nostril open wide and firing at 100%. And the cycle is that as the airflow increases, well, let me say it the other way. As the nostril narrows, the air that flows through it flows faster. It's an experiment they carry out many times. The smaller the vessel, the smaller the tube, the faster. If the tube has a narrow part to it, the air flows faster in the narrow part and cause a collapse to shut down the nostril. So gradually, the more opened one will get air slower, and as the other one opens up, then the airflow gets more, and as a result, it begins to narrow the airway. So there's a cycle, nasal cycle that operates. Now, if you have allergy or if you have any other thing, these are superimposed on the nasal cycle. So it's not unusual to have one block, one open.
I'm going to ask a stupid question.
No question is stupid.
Is there anybody on the face of this planet or in the history of the world who has had to live with one nostril being blocked 24/7?
Of course.
Really?
There is a condition when you're born called choanal atresia. Atresia means A-T-R-E-S-I. Atresia means it was developed with an obstruction. It was not fully developed, atresia. And a choana is the nose, and they refer to the back of the nose. So the front of the nose, you see two holes, right? Okay. If you were to take a plastic rubber or anything and push it, it will go right into your throat. So the two holes in the front open in the back of the nose. And these are the choana, C-H-O-A-N-A. So in some people, one can be blocked or both can be blocked.
Both can be blocked?
If both can be blocked, when the child is born and that both are blocked, that's another emergency. I didn't even have it written there, but now that you've mentioned it, as soon as the child is born, the child will cry. And they notice that every time the child's mouth is shut, he's turning blue. But the child is not conscious enough to keep the mouth open.
Yeah.
They just turn blue. And then you open the mouth and suction the mouth, it gets pink again. Mouth closed, it gets blue. And then you realize they have no breathing through the nose because these choanas are blocked. Both of them are blocked.
So that's a real emergency.
Oh yeah. And
Wow.
I've had to do it, and what you do is to put a mouth airway that is actually a little tube in the mouth, and that is going to go behind the tongue, short enough to just prevent the tongue from getting in the way.
Mm-hmm.
And then you can maintain them like this for a while. Eventually they would call the ENT, and then I would have to find alternative airways. What I normally do is there's a special procedure you can do where you punch a hole in the back of the nose. Some of them it can be a fibrous tissue and easier, and sometimes it can be solid bone. That in that little child that's 1 day or 2 day old,
Wow.
you have to find a way of establishing that airway. And normally when I do this, I put in a plastic tube from the nose into the back of the nose and tie the tube in the front so it doesn't come out on its own.
So the child can live like this for the rest?
Yeah, well, as the child grows older, then the hole you have created will widen and they can manage afterwards.
That's amazing.
Yeah. And so it is not a common condition, but it can happen.
It happens.
But back to your point, sometimes it's only one side that is blocked. And since they can breathe perfectly normal through the other side, they think everybody is like that. So you may get the side that is not open, a little bit of running, but they don't even know one is not working. Just like the air. Sometimes a child is born with only one air they're in from, and they don't know. And they will not know until they turn older, unless something else happens, whereby that air is blocked, the good air is blocked, and they can't hear nothing. And then you look and do the test and stuff. You can discover that. So that is a dire emergency in pediatrics, what we call bilateral choanal atresia. Bilateral means both sides.
Now, I don't want to take you too far away from your topic, but if sorry, you have a midwife, for example, who is helping with the delivery of a baby, and you have that emergency.
The midwives are trained, they would know, because they would actually put their finger in the mouth and keep it open.
Wow.
They would know, because they've been trained for that kind of thing. Though it's not common, but if you see the child is turning blue, then it's true that you'd call the doctor immediately, because normally, especially in hospital setting, the doctor is usually around when the child is being the child is being born. It may not be in the theater, but around, so that to take care of things like this. Yeah, so that is one of the emergencies, bilateral choanal atresia, meaning the back of the nose is not perforated. How can you know? You can know because there are a few ways. You can put a little bit of contrast, the kind of thing they use in X-ray to say, like, if they want to check if your stomach is working properly, you swallow this barium, and they can take a picture and they know where all the barium goes. Now there's another thing they use called gastrographing, more friendly for the GI tract. So they would put a few drops in the nose and take an X-ray. If the drops accumulate in a little pocket, they know it's blocked, because that thing you put in the nose should actually go right into the throat. So that's one way of doing it. CT scan, not terribly reliable, but you may get an idea. And you can do this the old traditional way, put a little catheter in it, which is a little plastic rubber, and the suction rubber. You push it down and realize that it's not going down, it's hitting a solid wall, then you know there's an atresia. But as I said, if it's one side, it's not much of a problem. If it's on both sides, you have a dire emergency, and that child will die if you don't put some measure in place.
Interesting.
Yeah, so you actually helped me to discover one of them. So children who have foreign body or something in the nose being pushed, and sometimes if they're a little older, they will not say if they did it. In fact, I have a situation where the child tell you, the child in the school put it in my nose.
Really?
Well, of course, maybe fear of repercussion from the parents. It is somebody else put it. But usually it will be one nostril discharging and the other one is clear. And usually there is something in there. If you cannot see it, then get an expert to look at it. And the things I have seen would have been cigarette paper, the foil part. I have seen things like the flat battery, the little penlight battery, the flat one. I have seen matchsticks. I have seen little stones. You name it. See all manner of thing in there. And the battery actually discharges, because it is a metallic thing. It discharges sometimes a green substance come out. That's the battery. That's the ferrous sulfate and ferric sulfate from the tree, and it can corrode the side of the nose. Sometimes it can be quite advanced before somebody sees it. I had somebody with many matchsticks stuck in there, and so all these things are possible. Then you have things like coins. Coins are more something they swallow. It's in their mouth. There's one particular child, big man, 14-year-old. He lie down and he had this little memory card, small square memory card, like half inch by half inch. So he throw it in the air and and swallow it and catch it with his mouth, in the air, catch it with his mouth. And one time he was doing that and he was coughing.
Oh my God.
As he inhaled, the thing stick in the lungs. So
wow. And then they have to call you.
Call me, do the X-ray, and you can see the thing, and then put him to sleep and take it out. So these emergencies. So when the children are small, you have to be careful, especially things like Lego toys. Remember, there's a time days where Lego, they put little bits together. Oh, Lego toys were famous in sticking that in the nose and in the air and swallowing them.
So why? I mean, do the children do that? It's just
several reasons. One, for example, there are many children who have large adenoids. The adenoid is a gland in the back of the nose, and that gland actually can block the air passage. And when the air is blocked, your middle ear is almost like you feel a blockage, but you don't know where the blockage is. And it irritates them. So they put things in there either to relieve it. And little babies, you'll be digging into the air all the time. I've seen that often. They don't know, they don't have the sense to tell you what's hurting them, but they put things in the air. So the children do, out of irritation, out of discomfort, they put things in it, and it sticks. So,
and of course, the most common one, at least from my experience with my children, this thing about just anything they pick up
in the mouth
at a certain point in time in their life. Why do they behave
because
like that?
That is the entire animal kingdom is like that. Because you spend, in a human being, you spend the first 4 years of their life protecting them from themselves.
Yeah.
Because and the reflex is everything in the mouth. Similarly, when the child is small, anything you put around the corner of the mouth, they turn their head, and because it's almost like a nipple. Anything that is close, they put it in the mouth.
I see.
So it's a reflex, a survival reflex that makes them like that.
Wow.
Just similarly, another emergency, since we are at it, I can tell you that. A child will be running and fall and bite the tongue. But the tongue is never bitten at the tip. That's what you expect it to be, because as the piece that will be outside of the mouth would have been the tip.
Yeah.
No, it's almost halfway in the middle. And many people have asked me how it is that way. And the most logical thinking is that there is a neurological type of reaction that is in the animal kingdom, where anything that is approaching a fall or a mishap, the tongue sticks out. So the tongue sticks out before they fall, and they end up biting it further back. So that is one. And when you are sewing that tongue, for those people who are doctors and maybe not ENT specialists, you have to have a certain way of doing it, because the tongue, you never wonder how the tongue managed to stick out. How does the tongue stick out when all muscles contract? Muscle doesn't lengthen. You have a muscle, and all the muscles in your arm, you pull it together, it contracts, it gets shorter, not muscle getting longer. So how can an organ get longer? And the reason is because the tongue is made of several types of muscle. Those that go lengthwise from tip to the back, and those that go across from edge to edge, edge to edge. So muscles all over the place. And as a result, when the muscle, think of it very carefully, when the muscle of the tongue, you stick it out, what is happening? The muscle from side, that's going from side to side, tighten, and those lengthwise relax. So it pushes the tongue forward. And that is how the tongue moves forward. I'm not going to ask you, how does a snake walk? But that's for another topic. Because it doesn't have legs. How you put a stick there, it doesn't walk. How does a snake walk? It's basically because of the legs are the ribs. And so it uses the ribs inside and walk with it. So, because in medicine, when you're studying physiology, you study comparative physiology, comparing other species to us. For example, and I'm digressing a bit, but the snake, when you as a human being open your mouth and raise your tongue, the floor of your tongue, where the tongue meets the floor of the mouth, have two little holes. And if you're not being careful, it spurts water on you. These are from the two glands under the mandible, the jawbone. Under the jawbone has a gland, a salivary gland called the submandibular gland. Sub means under, mandibular means mandible. A gland on there, and it secretes its salivary juice into a little tube, end up in the floor of the mouth. That's in human being. In the snake, it goes into the fangs. And the snake, the poison is produced by the salivary gland. And when it bite you, it squirt the thing. And that is, so you can see how close the anatomy is, the physiology is.
So since you're talking about the tongue, Dr. Suraj, now we have a lot of fads, right? For example, piercing the tongue and this sort of thing, right? Are there any negative outcomes to that sort of thing? Or is it that the tongue, after a while, if you remove the whatever you pierce the tongue with, right? What do you call them?
The studs.
The studs, right? Yeah. Is it that after you remove the stud, the tongue just goes back to its normal fullness?
Okay. So when you pierce the tongue, you put a needle or something. I have never seen it done for this kind of reason, but I understand how the tongue works. So you put the needle, just like piercing the egg, right? And then you cap the stud, both the round end and the clip, so you keep it there. What happens over the next weeks and months is that the skin on both sides, the top side, the dorsum we call it, and the underside, the skin around the hole keep on growing into the hole and continue to grow on both sides until they meet. And when they meet, you have created a canal. So if you were to take out the stud, you can put another one because a track has developed.
You're kidding me. So, because I was thinking, if you remove the stud, the tongue just goes back to its normal shape.
A track has been formed.
So if what you're saying is that after you decide to remove the stud, that track that is in there,
It's there.
it's there permanently.
Yeah. So if you put something blunt and seek it through, you can get to the other side. Just like you're piercing your ear.
Wow.
When you pierce your ear, the lobe is smaller, thinner, so the skin on either side begin to grow. And at the end of when it is fully formed, you can take off the stud and put a new stud and put anything else, and that's how the ladies change their earrings, because a tract has been formed. So there is skin lining the entire tract of that thing. And as a matter of fact, I'm sure you have seen people with a little dimple in the front of the ear. Sometimes it's
Yes, I have.
changing.
Yes, I have. Yes, I've seen
Right.
that.
This is when the child is very young in the mother's womb. The hair is developed from 6 little dots or 6 little points, and they come together and form one. Sometimes specifically the one that is by the front of the ear, that one tend to be not completely coming together, and a little gap develop. And that gap can be of varying length. Short one, and no problem. The longer ones get deeper into the substance, and you can get repeated infection. But there is a canal similar to the canal that is when you pierce. And so therefore, when I am repairing these, I usually have to remove all the canal. Because if you leave any of the skin, it's going to reinfect again. So, yeah, so that is one area where it is a naturally made hole in front of the ear.
So, just before we take the break, getting back to the issue of the piercing of the tongue, you said there's a permanent canal that is there, right? Even if you remove the...
Yeah, when it
stud?
heals, I don't know how long it takes, maybe months before it heals, because the tract grows very slowly. And it might take quite a few weeks before a complete tract is formed. Sometimes you can get infected in between and you take antibiotics, etc. Yeah, and one of the main thing is it has to be a sterile procedure to whatever extent you can make it sterile, but you leave it there until it forms the tract.
So, I mean, it may be a not so smart question, but are they aware that this is the outcome?
They may not know, the people who do it may not know the physiology, how it happened. All they know is that you put this in there, it might be painful, it might swell up, things might happen, but at the end of of a time, maybe a few months, you expect it to be able to be removed and changed.
Well,
So
since we're talking about that, I'll go a little deeper. I'll go a little deeper, Dr. Suraj, before we take the break.
All right.
You know that there are females who put those studs in the clitoris.
Yeah.
Okay. What about that? I mean, the possible outcome of something like that.
No,
Does the same thing happen?
There's no different outcome. Anytime the body heals, if there is a foreign body, because the stud or whatever you put in there, the body sees it as foreign and begin to work around it and begin to canalize.
So in the case of the clitoris, does the same thing happen? The canal?
Yeah.
Permanent?
Anyway, around the umbilicus, in the nose, wherever you put it.
The nose as well?
Oh yeah, everywhere. The skin will grow from either end and meet in the middle somewhere and form a tract that remains permanent.
Wow.
To remove that, you have to go in and take out that tract. But most times it's not necessary. It's not causing any problem. And once the tract is formed, unless something blocks it, it just remains as if nothing happened.
And I'm just curious, one more question.
Yep.
Are these procedures painful?
Not very. To me...
But Doc, you've done it already, man.
But... okay, what you have to look at is pain is usually the pain fibers are distributed primarily at the surface of the skin. So once you pass the skin, even though you go deeper, there's really not much pain, a little sensation. Until you pierce the other side, you feel the pain again. So that's why I say, because I give injection to remove keloids and to move many things. And if the needle is small, you don't really feel it so much. But to me, the danger there is infection, and you should be covered with antibiotics. I don't know how the people do their stuff, but infection, anytime you breach the protective skin, wherever you breach it, there's a potential for infection. So in medical terms, if we are to do that as a doctor, you clean the area first, sterilize the area, use a needle that is sterile, you use gloves, and you do a sterile procedure if you have to do that.
All right, Dr. Suraj, that's why I love this show. Okay, I learn something every week. That is
the
amazing.
Last time you asked me if I learned something, and yes, I did learn a few things, especially in the dental area. I did learn something.
Okay.
All right.
This is Doctor in the House live on Rev-Up St. Lucia 97.9 FM with Dr. Leonard Suraj. The program brought to you the compliments of Laplace Salaison, Ultramat, Susie's Variety, and Tapio Hospital.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapio Hospital, where the patient's safety comes first.
You are the guru of groceries. You have a heightened awareness for lower prices. You journey to find freshness and variety and quality brands. And you have an acquired taste for specialty items. You want to set a good example for your followers. And that's why your higher calling is Susie's Variety Store. 2 stores that beat the giants on pricing, variety, and quality. Susie's Variety, small store, big love. Located in Cantonment, Vieux Fort, and Bois d'Orange, Gros-Îlet. Telephone 458-4161.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
Laplace Salaison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laplace Salaison, of course. Laplace Salaison, Castries, Gros-Îlet, Vieux Fort, and Soufrière.
It's delicious.
This is Doctor in the House live on Rev-Up St. Lucia 95.9 FM, hosted by Dr. Leonard Suraj. Dr. Suraj, welcome back.
Thank you once again, and listeners, thank you very much for staying on and listening to us, chatting. You can join the group, actually, if you can ask a question or you can send us a WhatsApp. The fixed line is 572-9710 or the WhatsApp 287
0971.
0971.
Yes. Yeah, let me help you out there.
Okay.
Fixed line 572-9710 or WhatsApp 287-0971.
That's right.
It's a good time also to ask Dr. Suraj some burning questions, things that maybe you thought you knew or didn't know, myths and so on. Yeah. So we're learning a lot from the show, Dr. Suraj. And again, I want to thank you for your service. I mean, you've been here with us for about 2 years.
Yeah,
right, because you came on not too long after we opened up.
That's right.
And you had a number of shows and a number of special guests and so on. So I've learned a lot, and I know our regular listeners are learning a lot as we move on.
Yeah, well, I I intend at some point to reassess the thing and see whether I can compile it into a dossier.
Okay.
That's one of the things that's occupying my mind at some point. But yeah, we were talking about ENT emergencies, and we didn't get really very far because other things get in our way. However, if you want to contribute, we just give you the numbers, etc. So, yeah, back to emergencies. In children, I do children first because there are a few things I want to say there, and that is children swallowing and inhaling things. Any child less than 4 years, I will advise you do not give them peanuts to eat, because the peanuts can easily get inhaled. They can have it in their mouth. They get startled, or in chewing it, one or two may be still whole, and in inhaling, go into the lungs. When you get into the lungs, the oil from the peanuts, it's called arachis oil. It's a very corrosive oil for the lung tissue. And when it gets there, apart from the physical blockage of the small air passages, because you have the main bronchus and you have a smaller airway, apart from blocking that, it releases the oil that causes a corrosion of the bronchus. And that can be even more dangerous. So I think that we have to be very careful when you have kids that are less than 4 or approximately, to be giving them things like peanuts as a matter of and so forth. Also, anything with seeds, vegetable seeds, be very careful, or make sure they're chewing it in front of you one by one to make sure it's properly chewed. Secondly, ackee seed, the ackee we call shinette, because Jamaica have an ackee which is different. The ackee seed, it is slimy, it is easy to get in your mouth, it is easy to slide into your lung, and the size of it just big enough to block your airway. And if that happens as a dire emergency, you do what you call the Himlock's maneuver. You hold the person in front of you and take your 2 hands, put it under the rib cage, and give it a big thrust to see if you can dislodge that by pressing the lungs, if you can get it out.
Oh.
But it's a dire emergency.
I think you need your headphones because we have somebody on the line. This is Doctor in the House live with Dr. Leonard Suraj, and we have somebody on the WhatsApp platform.
Yes, hello, good evening.
Good evening, Andre. Good evening, Doc.
Good evening, sir.
Good evening to you. Thanks for calling.
Tell me.
Accepting my call.
Welcome.
Good.
Okay. Doc, some time ago you said children talk or speak with their hand, eh?
Speak with their hand.
Yeah, because mostly everything they do it with their hand, and anything. I think so. I don't want to. I don't know if I misquote you, but they use their hand to do a lot of things.
Yeah, but any example you want to give me?
Yeah, like for example, if they use their hand like to do mostly everything. Yeah, something so like they use their hand, anything they catch in their hand, either they put in their mouth or something
right.
like that.
No,
Right.
children at a certain age, anything they find, they put it in their mouth. So that is children who are 9 months.
That is
6
that
months,
is bracket
9
I mean.
months. Yeah, anything from hand to mouth.
So is like what they're thinking with their hands?
No,
thinking,
no?
it's a reflex. It's a reflex to
Okay.
get thing into their mouth, and so it is a reflex that deals with eating and surviving. So anything, if you put it on the, as I was saying, you put it on the edge of the corner of the mouth, they will turn their head to catch it. And
So let me ask you. I'm talking about me first. As an adult, Doc, how should I clean my ears?
Your ears, the air
Yeah,
cleans
how should I
itself.
clean
The air
So
cleans
this
itself.
thing
There are
of
some
using
airs. Huh?
the the bird thing not proper.
No, because the bird thing, you cannot see where it's going. If you put it in your air, you can only put it in the air canal, and sometimes you push more things in than you take out.
Okay.
So
And as
yeah,
a baby, a baby. So as an adult, I should not clean my baby airs.
okay. Well,
At
the
image?
way to do it is that you look at the air, and you pull the air lobe back, and whatever you think you can see, you can wipe it out because you can see it. But the issue there is, do not do it to yourself because you cannot see where it's going, and you
So
tend
somebody
to push
can
it.
do mine for me.
Well, if there is something they can see to remove, yeah. But don't push it where you cannot see where it's going.
So, Dr. Suraj, when you say the air cleans itself,
Yeah.
I'm a little confused because if you have airwax, how does it?
Yeah.
Doesn't the airwax just stay in there?
No, let me tell you. So if you assume the air has a canal, at the end of it has a drum. Okay. The drum has an outer part and an inner part. At the very, not middle, but there's at the very center of it has a little dot that looks, they call it the umbo, U-M-B-O. That is where the bone is attached from behind. Okay. If you understand me so far, then the rest becomes easy.
So if I so doc, let me try and finish. So if I feel like or somebody tell me my ears are dirty, have wax, so I can make somebody clean it for me. I mean, not somebody.
If they can clean it, yes.
So
if they can clean, if they can see something to clean.
But Dr. Suraj, if you're saying it cleans itself, why do people have to see the wax then? It actually, you see it in some people.
Yeah,
you actually see the thing on the outside of the air.
You didn't let me finish.
Oh, okay, sorry.
Okay.
Okay. Then the last one, doc.
Yeah, the last one. Yeah.
Yeah. I don't know if it is safe, but it is sweet. Once I finish bathe, I always like to put a feather in my hair.
A feather.
It's sweet and a feather, yeah. And is it safe to do? It is sweet, but I don't know if it is.
Yeah,
like
but the feather. They always say that the feather can carry fungus in your hair.
Oh, okay. I'll give somebody else such a.
Yeah.
Okay, caller, thank you very much. He said the feather is sweet.
I'll tell you, the air is very funny. The air has a center area that is responsible for coughing. It's not unusual at a certain point when you push something in the air, you begin to cough. And I've had patients whose cough reflex is so sharp that I just cannot get to clean that air. They cough and cough.
Oh, okay, I get you.
And there are areas in the air. There's a sweet spot in the air.
So maybe that's what the caller was talking about.
That is right. So it is not totally misplaced. There's a spot that itches and itches and itches. And sometimes you have to apply a cream, a numbing cream, to stop the itching. But that itching has nothing to do with wax in the air. And many people believe, oh, my air is itching because it's dirty.
Right, exactly. That's exactly right.
And so they go out doing things to the air that and prevent the wax from coming out. Now,
So, Doc, what you said there is very important because I suspect that's what most of us think, because that's what I thought. The minute you start feeling the itching, you say, okay, I need now to clean my air.
Right.
And to be honest, after you clean it with the swab, it feels better.
It feels better.
Yeah.
But the other thing too, when you finish bathe, sometimes the water gets in your air. Now the air is hairy. Sometimes the hair is very short and a bit of water can get stuck in it. And it can be very uncomfortable for your hair to be wet. And some people use a Q-tip to clean that. But I don't want to forget your question.
Yes.
So we got as far as the eardrum. The center of the eardrum, the cells, the skin covering the center, tend to grow faster than the skin around it. So it begins to push the skin away. Just imagine the center of the eardrum is growing faster, the skin. And so the skin will go and push and cause a movement of the surrounding skin outwards. So gradually, over weeks, months, the skin begin to shed. Your skin of your ear does not shed like dandruff, like flakes. It forms like a tube. All the skin stick together like they form a little round tunnel, and it comes out. And sometimes when you put the cotton bud, you roll it back in and it blocks. So the wax is formed by the outer third of the ear canal. The outer third of the ear canal has some oil glands. You know, the nose and other places have oil glands. But these oil glands are modified oil glands. They call cerumen gland, forming wax. They are wax forming glands. So you can fully appreciate that wax can only be made in the outer third of the ear canal. If you find wax, and the migration is from the outer ear outside. If you find wax in the inner part, close on the drum, somebody must have pushed it in.
Well, that's what we're asking Dr. Suraj. So then, if the wax is clear for everyone to see, I mean, except you can't see it, but you have people who will tell you, hey, there's wax outside your ear somewhere, right? So if you said it cleans itself, why does that happen?
Before I answer how it happened, the idea is that when you're bathing, the same rag you use, you can clean your ear with it. It will clean the part that is coming out. And the way the air is, if you clean that, then there's no need for anybody to see anything. So as it reaches outside, you clean it.
So you're saying that we should try to clean our air while we're taking a shower.
Yeah.
Okay. So whatever is on the outside there,
you'll wipe it out.
Okay.
You wipe it out every day. You wipe it out.
Okay. All right.
Having said that, I want to put a caveat on it. There are some airs, I see it very often, that the natural resting position of the earlobe is pushing against the canal and shutting it down. So sometimes the wax try to come out but get stuck at the very end. And I have many people like that. So it's a canal issue that they have. Not everybody's air is nice and straight and so forth. So these people, the air may never be able to clean itself.
Wow.
So
there's always an exception to the rule.
Yeah. So I have on occasion, I have to tell them, come every year, let me clean it for you. Come every 6 months, depending on how fast it grows, etc.
How would they know when they need to have it cleaned?
If it's blocked, the air is blocked and they cannot hear properly. But it's gradual. And there are some people, there is another condition that whereby the skin does not come out. The skin stays in and rolled up and just build up in the outer part of it and just stays there. So these people, you have to remove it again. And the condition is called keratosis obturans. Keratosis obturans, meaning keratosis means the keratin, which is the fibrous part of the hair. That keratin is multiplying, forming keratosis. Obturans means obstructing. So it is a kind of skin problem whereby the skin grows but doesn't come out and blocks the air. I see that condition quite often. In this case, you will not be able to do it yourself. You have to get somebody to clean the air and so forth. But it's only in the outer part of the air. It's nothing to do with the drum and everything.
But thank you very much for the advice, Dr. Suraj, in terms of using the rag or something while you're taking a shower to clean the air. Now, to be honest with you, I've never done that. It's always the Q-tip,
Oh,
and
okay.
that's it. But as you can tell, Dr. Suraj, I came to visit you recently, and you had to go in there to remove some of the some of that stuff.
You know, I normally leave the file in the office, so when I see the person, I have a blank mind.
Yeah, so I had enough of the
Okay.
Q-tips in my ear. Yeah.
So you had no reason not to have. Now, yeah.
Dr. Suraj, we have to say thank God, for doctors. I know some people see doctors as this and that and the other, but having a doctor around, that is a gift, as far as I'm concerned.
Well,
Because can you imagine? I mean, you spoke about a baby being born, and even then now the baby has there's all kinds of possibilities, things that could possibly go wrong. And you spoke about the fact that even when some babies are born, they're unable to breathe through the nostrils, right? I mean, thank God there are doctors there to deal with the situations. As you said earlier, when you have a child and the child has swallowed some object or something, I mean, that's a wonderful gift to know that there's a doctor who can come by and get that straightened out. So doctors are, as far as I'm concerned, they're a wonderful gift from God.
Well, yeah. The training takes you there. And it's like everything else in life. The personality is important as well. The attitude, and the training is important to develop the skills that you have.
Mm-hmm.
And some training ground teach you in such a way that you teach yourself. So they give you enough of the background that is required for you to self-teach.
Mm-hmm.
And to learn as you go along. And I was fortunate that I was trained in Scotland, the Royal College of Surgeons, and when within a few years of me returning here, my professor retired, and for the following 10 to 15 years, he used to come twice a year, and we used to do work here, and I learned a lot from him during that time.
Mm-hmm.
So it's continuous learning.
Yes, and upgrading and so on.
That's right.
We have another call.
Hello.
Yeah.
Hello, good evening.
It's me again.
Yeah.
That's okay. Don't you sound like you're apologizing for calling. We're very happy when you call. Thank you very much.
Okay, thanks for accepting my call.
You're welcome.
Doc, is your nose and your ears connect to each other?
Yeah. There's a tube. There is a tube in the back of the nose. So when you look at the front of the nose, you're not going to see it. It's far back. And that tube is connected to the air, to the middle air. It's a very interesting tube.
The reason why I ask that, Doc, because sometimes when I feel like my ears blocked, I hold my nose and try to breathe, and you feel it in my ear. I'll feel it in my ear.
Okay. Well, I'll tell you how important that tube is.
Yeah.
That tube is to enable...
I'll listen on the radio. I'll give you more than to call. Yeah.
Okay.
Right,
Have a good night. Have a good night.
Good night. So the tube is called the eustachian tube. It connects the nose to the middle ear. And the importance of it, the middle ear is basically an empty space. All it does, apart from carrying the sound through the three little bones, all it does is to create the same pressure as the canal. So you have a drum, just imagine you have a drum like a tambour, and then on both sides have air. If the pressure is not equal, the tambour will not give you the sound you want. And similarly, if the pressure of your middle air is not the same as the canal air, you will feel blocked, you will feel different. Sound will not sound the same, and the sharpness of hearing will not be there. So that tube is extremely important, and many times it get blocked. For example, the typical example people can identify with is when you're landing in a plane. Say you had a cold.
Right.
When you land in that plane and you get the air locked in your air, that is because the eustachian tube is not working. Either you had a cold or something. Children are famous for that. Almost a good 80% of children would experience it at some point because they have a gland in the back of the nose called the adenoids. And these adenoids grow from the time the child is born until they reach about 10, stop growing and then shrink away by 14, 15.
Let's take a final call, Dr. Suraj.
Hello. Hello. Good evening.
Good evening, Dr. Suraj.
Thank you for calling.
Ask a question. You're welcome. So the vertigo when you have the ringing in your ear and it lasts, do you know if it will ever go away? I know you're not an ENT, but I figure out you might know about the ear.
Oh, okay. The vertigo is, by definition, it is dizziness due to due to the air, vestibular apparatus. Now, the ringing on the air and the dizziness may not be the same cause.
Yeah, so I don't have the dizziness, but the ringing has been there for a year and 6 months. I don't know if I pronounce it right. I think something called tendinitis or something like that.
All right, I'll tell you. I'll tinnitus.
Okay,
tinnitus.
But Dr. Suraj,
tinnitus.
Can you? What is the ringing of the air? What is that?
Okay.
What does that sound like? A ringing of the air?
You never had it?
I don't think so.
Sometimes, Andre, sometimes they say, a long time you used to say, oh, somebody talking about me. It's that ringing, but it stays there 24/7. It doesn't go away. So when I lie down, doc, and I go to bed, I feel better when I'm sitting. But when I lie at night, I almost feel lightheaded because the ringing is so bad.
It's so bad. Okay. The ringing is because the nerve for your ear is irritated. And it is firing away and causing a ringing sound.
You mean like a bell or something?
No.
Is it ringing?
There are different tones. Sometimes it can sound like a whistle.
I don't know.
Like a whistle?
Demonstrate yours for me, please.
You know what? Crickets. You know crickets? Like this is the man that does calls.
Right.
Use that noise in his background.
Okay.
That's what I hear in my ears since my surgery, and it hasn't gone.
The ring you're talking about, it can vary. It can sometimes sound like a kettle, like a boiling kettle. High.
Yes.
That's a high pitched sound. Now the air itself has different. The cochlea has a different areas where it perceives different sound. So if we assume a starting point is that the ringing is because the nerve is irritated. And what irritates the nerve? Anything in the path of the nerve can irritate it. And the nerve begins in the inner ear called the cochlea. And something can cause the cochlea to malfunction, and then the ringing starts. Or it
I guess I'll have ringing for the rest of my life.
Not really. Sometimes it burns itself out. You've done a hearing test?
I've done everything. I'm funny. We talk about doctors in St. Lucia. I've been waiting for ENT for a year and 9 months here in Canada.
Oh.
Canada, whatever. Andrew.
Canada,
Really?
You're right.
Yes. A year and 9 months I've been waiting
for an ENT.
The vertigo.
Well,
yes. So that happened April last year.
Okay.
Yeah.
So, and what surgery you had to your ear?
I had I don't know if you ever heard the cancer gene for breast cancer and ovarian cancer. BRCA1.
Right.
I was 85% chance of cancer, and I did prevention surgery.
Okay.
And since that, I've had a ringing in my ear that has.
So what I wanted to know, the surgery had nothing to do with your ear?
No.
Okay.
But I think it's the stress. I think from the surgery, they said stress can also bring it down. But I was just curious because you were talking about the ear, so I was just like, let me call and see.
Now I have a little more information. Sometimes the anesthesia, being put to sleep and things, you may have a low oxygen period that can cause that. Now, basically the ringing of the air is because one set of nerve cells are not working properly, and therefore discharge on their own and make a sound. And so that's called tinnitus.
And I'll have that forever, I guess.
I don't think so. It may not be. And you had a CT scan?
Yes, I did.
They didn't see
And
anything?
an MRI. Yeah,
Okay.
nothing.
Yeah. So in other words, you don't have a tumor or anything like that. It's just that the nerve is causing a problem. Usually the hearing test might show which area, which frequency that are dropping. So in that case, I think what you can do is you'll find that at nights it is much noisier.
Yes,
And
I
if you
put
block
on
the air,
white noise. Yes, I put on white noise.
So what some elderly people have told me when I was running a clinic in Scotland, they tell me, my son, I try everything, it's not working for my tinnitus. I take my grandson's Walkman, I put the music on, and I fall asleep.
Yeah, that's what I do.
So if there is a noise that you like or compatible with you, then that can help you to fall asleep.
Yes.
But does it wake you
That's
up?
what I do. Sometimes when I feel lightheaded, it's almost like in my sleep. I think the first episode was I felt like the house was turning upside down. I guess that's the vertigo. I don't feel that bad anymore, but the ringing, it's so annoying. Sometimes I have good days, like even talking to you right now, it's just so loud in my head.
Okay. There is something called a tinnitus masker, which when you get to see your ENT, they may consider that. It looks at the frequency of the sound and have an opposite frequency that can cancel it. But I think in the meantime,
I will call one another time to let you know. They actually called me for November, that's a long time to just wait for ENT.
Yeah.
So St. Lucia, don't complain. So thank you so much. Thank you, Andre, for taking extra time.
So sorry. So even in Canada, you're saying that you have to wait that long for ENT?
Yes, I had my surgery in January 2024, and then in April 6th, I got up with severe vertigo, dizziness, vomiting, and I actually came to St. Lucia. When I was in St. Lucia, Andre, I saw ENT, but I brought all the tests with me, but he didn't do. There was nothing I guess he could have done. So my ENT head, they just called me, and I'm going to see them November this year.
Good luck.
So I know.
And bring all your information to them. Everything you have, bring it to them to expedite the process.
Yes, thank you.
Thank you.
Okay.
Thank you for calling. Have a good night, Virginia.
Yes, thank you.
So Dr. Suraj, how do you... Okay, so safe night to you. How do you explain that? I mean, I wouldn't imagine Canada she has to wait that long. Or is it that there's a huge demand for the ENT specialists?
Demand for the
okay.
Not only ENT, but the healthcare basically is free.
Oh,
and,
okay. So you have a huge amount of people who are on the waiting list.
That's right. Yeah.
Oh boy.
So that's the problem with some of the health service.
Mm-hmm. But Dr. Suraj, one of these days, I think you need to do a program on vertigo, because quite a few people, including, and I was surprised, I know some young people who have this issue. I thought maybe that was a problem for older folks.
No. So one of these, when I have a single program like me alone, I can do the vertigo.
I think so, because it seems to be very, very common right now. Any idea as to why that has become? Because I can't remember over the years hearing about it. I heard about vertigo, but all of a sudden we have about vertigo.
Vitiligo is a skin coloration. Right.
Yes.
And vertigo is a dizziness due to because of air issue.
And is there a cure for that? Any cure?
Well, if you can identify what's causing it, usually it is the the balancing mechanism that has gone off. And the balancing mechanism is extremely complicated, meaning that for you to remain properly balanced, in other words, you're standing up and you stand on one foot, you can maintain that. And when you close your eyes, you know you're still standing up, you know you're not upside down. This takes the combined effort of many organs in your body. The brain, the air, the nervous system from the sole of your feet to the neck.
And imagine, we take that for granted.
We take it for granted.
Wow.
That, for example, that is why a bird can be asleep on a branch and it's raining or it is windy and the bird can sleep. As the wind rocks the bird, it rocks on the tree, but its feet are grabbing the branch and can withstand all the movement and does not wake up.
Amazing.
And so, because it can correct itself without going to the brain, the sleeping brain, it's a spinal cord kind of reflex. Similarly, the same reflex, somebody give you something that's hot, say like a cup, hot, you didn't know it was so hot. As soon as you hold it, you quickly drop it, even before you're thinking you have dropped it. Or it also, you hold something, it's hot, but you cannot let it fall because it might spill somewhere.
Right.
So you take the burden. That means that the initial reaction of dropping it has been bypassed by a conscious decision not to drop it. All these happen so fast because of reflexes that keeps the brain going.
Amazing.
Yeah, it's a very complicated body. Physiology is phenomenal.
And something now causes this thing that happens naturally. All these intricacies as to how they function, and we take them for granted.
That's
something
right.
caused that to go out of whack.
Definitely. There are illnesses that cause it to happen. There are illnesses that cause the what you take for granted. You breathe in, breathe out, breathe in, breathe out. That's controlled by a center in the floor of the brain. And sometimes when you have tracts that are not working properly, then you just can't breathe. They have to support your breathing, and many people die because they have to be on the breathing machine all their life.
So, do you think just thinking from the top of my head, do you think that the vertigo has something to do with some other issues that are going on?
Oh yeah, there must be. When you're investigating vertigo, you have to do blood tests, CT, MRI, and all these things. You have to look at genetics, etc., to see is there something that is causing the nerve, irritating that nerve.
But people who have this condition told me it's terrible. It's terrible.
Yeah.
That everything is spinning around them.
And there are maneuvers you can do to see if it is the chalky deposit that has come off the air, then there are ways you can reposition it with some exercises, etc. But we can discuss that next time.
I think so. At some point in time, when you're able, Dr. Suraj. Okay.
Right. Well, listeners, thank you very much for listening to this program. And next week, same time, we'll be there again. And I wish you all a pleasant evening. Thank you.
Thank you very much, Dr. Suraj, as always, for your service. Much appreciated. Okay, this has been Doctor in the House, live on Rev-Up St. Lucia, 95.9 FM. Brought to you with the compliments of La Place Salison, Ultramart, Susie's Variety, and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient safety comes first.
You are the guru of groceries. You have a heightened awareness for lower prices. You journey to find freshness and variety and quality brands, and you have an acquired taste for specialty items. You want to set a good example for your followers. And that's why your higher calling is Susie's Variety Store. 2 stores that beat the giants on pricing, variety, and quality. Susie's Variety, small store, big love. Located in Cantonment, Vieux Fort, and Bois d'Orange, Gros-Islet. Telephone 458-4161.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered.